afternoon, everyone. Thank you for joining us this afternoon. I'm Payal Patani and staff for Forbin Community Prevention Coalition. We are a program of Forbin Regional Council on Substance Abuse. Thank you for joining us on our third town hall meeting, and I will let Lauren Beckwick introduce our speakers.
So Dr. Shell Laji, better known as Dr. Shell, is an expert in wellness, aesthetics, and comprehensive approach to living our best lives naturally. She's been practicing medicine for over 20 years and is considered one of the leading edge of functional medicine, integrative care, and aesthetics. Dr. Shell helps her patients regain their healthy balance so that they can look and feel their best. As a board-certified OBGYN, Dr. Shell masterfully restores hormone balance, introduces patient-specific nutritional supplementation, creates a healthy gut, reduces stress, and reverses the signs of aging through her complete approach to inner and outer vitality. Dr. Shell is the author of I Am Woman, Our Journeys to Health, Happiness, and Harmony, as well as a highly sought-after international speaker and trainer who focuses on educating physicians and other practitioners about treating the entire patient, not just symptoms and test results. Her passion has always been in women's health. This is evident as she inspires women through international speaking, writing, media appearances, and inspirational videos to believe that they deserve to achieve their goals for complete mind, body, and spirit balance in their lives. She is very involved in her community and has served on several boards and volunteer positions. She is also a devoted wife, a mother of two beautiful children, ages 19 and 16. Please welcome Dr. Shell.
Hey, nice to be here. Thank you so much for having me.
Yes.
So without further ado, I have been asked to speak about self-care during this pandemic and COVID that all of us are dealing with. And I'm honored to speak to you all about this because this is so very important and such an important topic and very near and dear to my heart. As I myself have two teenagers, two adolescents who are going through a lot, just like every other person out there. So this is a very important topic, and thank you for thinking of this and organizing it. So I'd like to thank the organizing committee for doing this. I'd like to start with what kinds of things one should look for, symptoms that they should look for and watch out for if you're seeing this in your children and in your families. Especially in this unprecedented time, it's really important to be really on the observation mode. So you want to look for things like if they're having trouble focusing on daily activities, anxiety that may turn into feelings of being out of control, strong feelings that may interfere with daily activities, and if they're having emotions that become difficult to manage. And the final one is look for feelings of hopelessness and helplessness. This will trigger the thought process that, perhaps we need to become more involved. And the other two speakers today are fantastic, and they'll be addressing a lot of different tools as well. So with self-care, I like to, and I've done this for well over 20 years, and the book that Lauren mentioned, it's all about taking care of yourself and looking at that not as something selfish, but it's more self-preservation. And especially as community members or even parents, we think, well, we have so much to do and we simply don't have time to take care of ourselves because our list of things to do is so very long. But remember, when you are better, they are better. And when you are taking care of yourself, you are actually doing so much for everybody around yourself because you will then be able to help them take care of themselves. You want to be the best version of yourself. And that's where self-care really comes in. You need to focus on what's going to make you the best version of yourself and make you happy and harmonious and balanced. And that way you can enjoy your life and you can get through this time because we know we'll get through it. As a community, as a global community, we will get through this. We don't know how, when, but we will get through this. And in order to have you really take things home that you can remember, I've created this acronym that I like to share with my my patients and my community at all times, and it's faith, Faith. And I love the fact that it's faith, because we really have to have faith that we can get through this as a community if we stick together and really help each other. But when I talk about faith, so let's kind of dig in and see what that stands for. So the F stands for foods that you're putting into your body and the hydration. And we'll come back to all of these in just a minute. So that's your F. Your A is activity level and making sure that you are doing activity and exercising. Your I is introspection. And when I talk about introspection, I'm really referring to mindfulness, deep breathing, meditation. The T is take time for yourself. Because if you take time for yourself, you will be re-energized, your cup will be full, and you can then give back to everybody that's counting on you. And finally, the H is healing sleep, because you cannot heal if you do not sleep. Sleep is where healing occurs. And so just to kind of outline the next few minutes, we're going to talk about all of these aspects. So let's start with the foods, the F. When you talk about food, everybody's heard of the Hippocratic Oath, and that particular scientist centuries ago left us with something that was so remarkable and so deep. And he said, let thy food be your medicine, and your medicine be thy food. Now, why is this important? Well, it's because we don't want to be a pill-popping generation, right? We don't want to really think about everything has a disease process associated with it and there's a pill for everything. What we want to think about is, what are we putting into our bodies that is going to fuel our bodies with a healthy, well-balanced diet and drinking plenty of water. So a little tip on the water, hydration is key. Hydration is how you're going to detoxify. And if we talk about toxins, and I'll come to this again, but when you speak about toxins, we are surrounded by toxins. We are just inundated with toxins, whether it be our home cleaning supplies, our moisturizers, our makeup, our body things that we use on our body, things that we use around our backyards, things in the air. We are surrounded by so many toxins, and some we can control by removing it, by going organic in our foods, eliminating pesticides and the chemicals, but there are many that you can't, right? So you need to detoxify on a regular basis. So you take your weight, you divide it by 2, weight in pounds divided by 2. So as an example, if you weigh 150 pounds, for example, you divide it by 2, that's 75. And I always say add 20 ounces to that. So if you weigh 150 pounds, you want to drink at least 95 ounces of water a day. Now that may seem overwhelming. Oh my God, that's so much. If you really break it down, it's not, and this is something that's so important. And as I'm doing this, I've always got my water with me. And of course, use containers that are not plastic, because that's another toxin that you need to avoid, the parabens and the plastics, the BPA. You want to avoid that and get some glass and other containers. That's really important with self-care, because you are now eliminating the toxins on an ongoing basis as you eat and drink the right foods. So to make it easy, I always tell my patients, if you can afford to go all organic, fantastic, go all organic. If you have, the concept that it's quite expensive, and it can get quite expensive, then at least look at the Dirty Dozen, and you can just very easily look that up online. Look at the Dirty Dozen, which are the most chemically infused foods, and stay away from those. Make sure you're buying those as organic, and the others you can sort of cheat on. But water, the right foods, making sure you're getting the right nutrients, and you've got to make sure you're getting a healthy balance with the healthy fats, the right carbohydrates, not the simple carbs. You've got to go complex, and you've got to get enough healthy protein and a lot of fruits and vegetables. Lots of fruits and vegetables, because that's what's going to give you your fiber and your phytonutrients and your antioxidants that occur naturally in nature, and you really need to give your body that so that you can continue to heal without having to take a lot of medications. And before we go away from food, whether you do the best diet or not, the food and the soil today, in today's day and age, for example, does not have the same kinds of nutrients as it did, say, 50 years ago. So your tomato is not going to have as much lycopene as it did 50 years ago. So you're still going to need to take some very basic but very high quality supplements. And this discussion does not permit me to talk about that so much because it's going to be short. But we need to really, really focus on high quality supplements. And you can go to my website, drshell.com, and look at some free blogs and find out more about the right supplements that you need to take, because that is where you'll get the nutrients that sometimes you can't get from food. So remember, F for food intake and hydration. Next, let's go to A. The A is for activity. Now, it's really important when you're taking care of yourself to get exercise every single day. Now, when I'm saying exercise every day, you don't have to spend an hour or two every single day, but you do need to become active. That could be a walk outdoors, that could be yoga, that could be some resistance work, that could be running, it could be cycling. Of course, in today's environment, you want to make sure that if you're spending time outdoors, you want to maintain your social distance and use the right precautions so that you're keeping yourself safe as well as others safe. But activity has been shown to release the happy hormones. And you need those happy hormones. You need the serotonin and the dopamine. You need those hormones to have those happy thoughts and relieve that anxiety, because that is what's really affecting millions of people right now, is the anxiety that is related to having being surrounded by the COVID and all the social media and the media talking about all these scary things. And you've got to just get away from that for a little bit and you have your body moving. When your body moves, your body, once again, detoxifies. It detoxifies negative emotions. It detoxifies the toxins that we're surrounded by. So activity is something that you really need to consider bringing into your life at least 30 to 45 minutes a day. The days you can do longer, awesome. The days you can't, surely we can all find 30 to 45 minutes of just some activity. And if you can't do that, 15 to 20 minutes, you've got to start moving. Especially a lot of us are working on Zoom or online schooling with Zoom. You've got to get up between your classes, walk around and do a little stretching. Very, very important. One of my favorite things to do is yoga. Yoga is something that is so important for self-care because it accomplishes two things. It accomplishes stress relief as well as stretching, flexibility, balance, and just a complete overall head-to-toe care. One of the free apps I can suggest that I use myself almost every day is called Down Dog, so you can write that down. It is a free app, and I'd highly recommend it for beginners as well as for more advanced yoga practitioners. So let's go on to I. The I is for introspection. Now let's talk about that for a second. Why do we want to introspect? Because this is where peace lies within you. And if you don't have the connection to yourself, if you're constantly connecting to the world outside, whether it be through television, social media, FaceTime, Zoom, whatever your choice is, or in person, you are not connecting inwards. So you've got to try to go inwards and get to know yourself and go into silence. You know, centuries ago, we had mathematicians such as Pythagoras and Pascal, the Pythagorean theorem. All of you have heard of the Pythagorean theorem and Pascal. They actually have left us with instructions where you need to go into silence. And some of us just aren't used to silence, right? Some of us are afraid of silence. Some of us get very anxious when it's silent. So try 5 minutes. 5 minutes of just sitting in a beautiful place. It could be anywhere, outdoors, indoors, what have you. Close your eyes, don't close your eyes, doesn't matter. But just be silent and focus on your breath. And if you want to learn a little bit more about deep breathing and meditation and mindfulness, there are some wonderful free apps that I could recommend to you. Some of them are Insight Timer, you can write that down. Calm has a free version. Headspace gives you 10 free sessions. Go into some of these apps for some guided work. The 5 to 10 minutes is where you need to start, and then you can build up to whatever works for you. 30 minutes, an hour. But the best way to, and the easiest way to learn deep breathing is I always tell my patients, do a square breathing technique. 4 seconds in, 4 seconds hold, 4 seconds out, and 4 seconds hold. That's only 16 seconds. If you do just 10 of those breaths, you're going to feel like a new person. And please try that today after this seminar, and you will absolutely feel the difference that I'm asking you to feel. Mindfulness is something that we know that large, high-end executives do, doctors do, students do. We have it in schools now. It's a fantastic way to take care of yourself, connect with yourself, okay? So next we have the T in faith. Take time for yourself. Once again, there are many things you can do, where you really feed your body, you feed your spirit, you feed your soul, you feed your emotions. Some things that I can suggest are journaling. Start a journal. If you've never done it, just pick up a new journal and start writing. You can pick a subject to write about each time you make an entry, or you can do something where you're just looking at gratitude. Write down 5 things a day that you're grateful for. It could be anything. And certainly all of us are grateful for at least 5 things, because it's really important to start your day and set the tone where you are practicing gratitude. When you practice gratitude, really interesting scientific things happen. Your cortisol level, which is your stress hormone, actually decreases. Your happy hormones increase. At night, your melatonin increases. Gratitude is like magic. If you can practice gratitude and just list out 5 things that you're grateful for and write it down, it's going to do wonders for you. Some of the other things that you can do is share something that's made you proud or happy in the past 2 weeks. Give yourself a pat on the back. Give yourself a little, hey, good going there. Don't constantly criticize yourself, because that's not what's going to serve you. It's not going to feed your body and a soul. Make a list of things that you'd like to say no to. If your plate is overloaded and full, too full, you need to make a list of things that you can just say no to. Declutter your desk, declutter your room. Spend an entire day without looking at social media. These are some of the things that you can do to take time for you. And my favorite, get up early in the morning one day and watch a sunrise. Or watch an amazing sunset. We have beautiful sunsets in Houston. Watch an amazing sunset, something in nature that you should appreciate, that you rarely have time to notice. And those are some amazing things that you can notice where you can really take time for yourself and feel like you're healing. Say a mantra that brings you comfort, such as, I am confident, all will be well, or may I be happy and healthy. These are wonderful things that you can do to just take time for yourself and do something that you love. It could be art. It could be making things with your hands. This is a very rare time. It is actually giving us the gift of having more time for ourselves. And so when we have that time, let's take it for ourselves. And when we're better with self-care, everybody will be better, because we will give away that energy of positivity and the energy that everybody wants to be around. Now, the H in faith. The H is for healing sleep. Now, why do I talk about sleep? A lot of people will say, oh, I can survive on 5 hours or 6 hours. I don't need much sleep. Well, as a physician, I'm here to tell you, you need sleep to stay healthy. Sleep is one of the most vital things for your health, because a lot of things happen while you're sleeping. One of the biggest things that happen is regeneration of your stem cells, of your neurons, of the connections between your neurons. That happens during sleep. Healing happens during sleep. Detoxification happens during sleep. All of this happens where we are surrounded once more by a lot of stress. And stress yields to inflammation. Inflammation leads to diseases, chronic diseases such as cancer, such as neurodegenerative diseases, autoimmune diseases, stress is one of the biggest killers. And when you sleep, your cortisol levels come down. So you're able to reduce that inflammation, build your immunity, enhance your mood, reduce anxiety, reduce depression. Most of my patients, I always advise them to have 8 hours of sleep. Some people, if they just can't, at least 7, that's your minimum. And then closer to 9 hours for kids and adolescents is where I like to say you need to kind of give yourself this wonderful healing power that you can heal with. And it's all in your body. As a physician and as a functional medicine doctor, integrative physician that I've practiced for over 18 years, I'm here to tell you your body is an amazing, amazing piece of machine, if you will. Scientifically, it has all the functions of being able to heal itself, but you've got to give it the raw materials. The raw materials are you've got to give it the right foods, the right nutrition, hydration, activity, and exercise. You've got to give it that silence and mindfulness. You've got to do something joyous that brings you joy. Take time for yourself. And finally, the sleep. It is so crucial. So be gentle with yourself during this time. Be gentle with yourself. Be gentle with those around you. Times of high stress can bring out both the best and the worst in people. And it's wonderful when it brings out the best. And if you start taking care of yourself, if you're a parent listening, or if you're a student listening, if you start taking care of yourself, something magical will happen. Everybody around you will see the change that that's making, and they too will follow suit. So stay calm, stay well, stay healthy, harmonious, and happy. And God bless.
Thank you so much, Dr. Shaw. That was amazing.
Thank you.
All right, so next we have Dr. Celeste Conlon. Dr. Celeste Conlon is a licensed psychologist for private practice in Sugar Land. Her physical office is near Dairy Ashford and 90, but during the pandemic, she sees clients 100% online. She is also an LSSP and worked in schools for 20 years with a part-time private practice. Although about 9 years ago, she moved to private practice full-time. She is also a certified cognitive behavior therapist, holds a diplomat status from the Academy of Cognitive and Behavior Therapies. She's a board member of the National Social Anxiety Center. She's married to Dr. Bob Conlon, and they have 2 children together. Her 2 main specialties are children and adolescents, including anxiety, depression, behavior, ADHD, autism, and social problems. And then 2, she does all ages, and she specializes in anxiety in all its forms and also depression, specifically social anxiety, OCD, and related disorders, panic, school and work refusal, social problems, and social skills. Welcome, Dr. Conlon.
Thank you. It's so nice to be here, and I really appreciate Dr. Shell and all her wonderful suggestions. I'm going to talk to you today about how we get ourselves stressed out and a little bit about what to do about it. I think it helps to know just how it works, and so I'm going to talk to you in a real practical way, pulling from some of the evidence-based strategies from cognitive behavior therapy. You know, we have a lot of things to worry about these days, don't we? We have hurricanes and politics and protests and riots and COVID, unemployment, and how are we going to get our kids back into school safely? And that's not even our health or our families or our futures that we just normally do. And I just want for a moment to just talk to you about how are we all managing? Because you may not realize that everyone is in this together because we're so isolated. You're not necessarily seeing each other. You may be talking with a friend or 2, but I see people all day long. And let me tell you, no matter how you're feeling, you're not alone. There are a lot of people that are feeling the way you are. And partly it's COVID, partly it's just what's going on What I'm going to talk a little bit about just the mechanism for how we develop anxiety in the first place. And so the first thing to know is that our brains are so wonderfully made. We have two major parts to the brain. We have this fancy human brain that has all this good thinking that we can do up here, and problem solving and math, and if you're going to school, if you're working, you use this part of your brain all the time. But we have this other part of the brain. It's the old part of the brain, the automatic part of the brain, that every living creature on the planet has. And that's the part that makes our bodies work on automatic. I mean, think how exhausting it would be if you had to go around all day saying, breathe in, breathe out, breathe in. It just goes on automatic, and there it is. So we have breathing, and we have heart rate. And if you get too hot, you sweat. If you get too cold, you get goosebumps or the chills. It regulates our temperature. There's also this little tiny bit in the brain, in the old brain, called the amygdala. And that is where we get fight or flight. You might know about fight or flight. You've probably heard about that. And in a long time ago, when we did not have homes or air conditioning and people were just living off the land, we had to have fight or flight to save our lives. If you happen to come across a tiger, if you and I are walking out in the woods and we come across a tiger, think about what you would do. This is a live tiger. It's not caged up or anything. I don't know about you, but I am almost sure that my feet would be moving before I had a chance to even think, because the amygdala gives us an immediate burst of energy and power, and we are moved to action. Some people freeze. Some people would stay and fight the tiger and yell. I'm not one of them. But this is the thing that's so marvelous about our brains. During the time when we are faced with an immediate threat, have you ever noticed when you're really, really scared that you can't think clearly? You might have been, let's just say you're driving in Houston before COVID and you're in crazy traffic and you drive and you have to take evasive action because somebody has cut you off. If you've been driving for a long time, you did that almost without thinking. And then after the immediate urgent thing was over, you had a flood of emotions. Maybe you were crying, maybe you were swearing, maybe you were just sweating or shaking. But if you're in a near accident, you're going to have some emotions, but you're also going to have this immediate reaction. That's the amygdala. The amygdala is what saves our lives. It allows us to take that prompt action. And even though we don't have tigers, most of us don't have to deal with tigers on a daily basis, that ability to have that fast reaction to save our lives, it's part of our biology. And it's a really good thing that we have it. Think about how that affects us with COVID. When we are hearing that we should wear masks and be socially distant, maybe when it was going on in New York, we go, maybe, maybe not. Different people had different ways of handling that. But when it became much more prevalent in Texas, and especially in our area, people got a little bit more concerned. That fear that we have has been able to protect us. That's the job of fear, is to protect our lives so that we can survive. And just so you know, the amygdala is the fastest reaction in the human body. We are built to survive, and it is going to take over. All right, so what does that have to do with anxiety? Well, I'm going to get to that, but I want to tell you about a couple of things related to pain and anxiety. First thing, when we're thinking about change, I think of 5 areas. First, I think about what's our environment. Then we think about what's going on in the body. We think about what's going on in the mind. as in our thoughts. What's our mood like? What's our behavior like? So we've got those 5 areas, and we can't always change all of them, but they're all interconnected. So if you change one, you might change, you're going to have a chain reaction in the others. If we have COVID, we can't necessarily go live somewhere else. We just have to put up with it. So we can't change our environment, but we can change what we decide to do. We can change our behavior, or we can change our attitude. If you have pain, you cannot, it's like, well, my body is involved. How am I going to change that? There's still a way to address pain in the body by using one of those other areas, changing your environment. Going outside and getting some fresh air often will take your mind off of it. And of course, people have different layers of pain, and so I'm not wanting to discount anyone's pain, but there are all of these things that cognitive behavior therapists do with pain, including changing your attitude toward it, addressing some of your feelings, changing your behavior, and some of the things that you do with your body. In fact, when we look at anxiety and pain, if you go into a pain doctor, they'll give you a chart of your whole body, and you're supposed to X where does it hurt. If you come into an anxiety specialist, they're also going to give you a picture of your whole body and ask you, where do you feel the anxiety in your body? And it's many of the same places where the pain would reside and where the anxiety would reside. And in fact, it turns out that there's a strong connection between pain and anxiety. You also might know that anxiety is the most common mental health concern that we have. 25% of the population suffers from an anxiety disorder sometime in their lifetime. And somewhere between 35 and 60% of chronic pain patients also are diagnosed with anxiety. Most commonly, panic disorder or generalized anxiety disorder. What we don't know is which came first. We do know that people who have an anxiety disorder but maybe never did anything about it, if they happen to get chronic pain, then their anxiety gets worse and then it gets reported. People with pain and people with panic have some similar vulnerabilities, like they're more easily aroused. They notice things in their body. Like, think for just a minute. Think about your feet right now. Think about the pressure that is on your feet. Maybe your feet are on the floor. Maybe you're wearing shoes, or maybe you're not wearing shoes. But wherever your feet are, they typically are pressing against something, and something is pressing against them. Now, that's a somatic cue. That's your body cue. But most of the time, we ignore that unless you're doing a mindfulness exercise. You wouldn't even think about unless your feet are hurting. You're not going to think about the pressure on your feet. Most of us go around and ignore gravity. But where we put our attention and where we notice things differs. If a person has pain or if they have panic, they typically are more sensitive to those things. It's also possible that some people use worry as a strategy for reducing their sensitivity to their body experiences, making them more prone to developing anxiety. Let me give you an example. If you're in pain and you sit with it and you're thinking about the pain, you might eventually decide to do something about it. You might get up and move around. You might look on the internet, try to figure out what's going on. You might use Dr. Google, and try to diagnose yourself. You might do a lot of things, but while you're doing all of that, worrying and wondering and thinking about it, your mind has gone away from the pain and it's on this intellectual activity. And so worry actually becomes kind of rewarding because it is a habit that you can use to avoid the pain. And so that's how worry can get established in a person that has pain. Just know that there's a lot of overlap between pain and chronic pain and severe anxiety, and the worse the pain, the worse the anxiety in most studies. There is also connection in the brain. You know, I was just talking about reward, how worry can get kind of rewarded because pain goes away. The same thing happens with addiction. There is a reward system going on in there, and I'm not an expert in pain nor addictions, but in general, we know that these mechanisms overlap. And I'm telling you about this because I'm going to get around to telling you about fear and avoidance. Even substance abuse itself becomes problematic because it's used as a form of avoidance. It's very quick, and it helps a person avoid whatever it is they need to avoid. So the thing to know is that nothing feeds fear like avoidance, whether it relates to addiction, career, love, health, anything else that matters to you. It's fear that keeps us stuck, and we can change our situation by learning how to manage the anxiety. One of the things that happens quite a bit with any sort of mental health issue is that we get stuck in the way we're thinking about things. So there is this automatic process. Remember, I told you we have these automatic fear reactions. Well, we get in the habit of having automatic thoughts that go along with them. If we are having a problem, then we automatically look for the negative, and that's part of the brain. You know, that's just part of our history of our biology, is that we look for the negative because we want to see, is there a threat out there? And so we automatically go to sometimes the worst case scenario. Think about COVID. A negative thought might be, COVID has ruined everything. Life will never be the same. What we know from cognitive behavior therapy is that thoughts are not facts. COVID has not ruined everything. Life will never be the same. That might be true, but we actually don't know. We don't know if COVID has ruined everything or something else has ruined something. We just don't know. That's basically not a helpful way to think. We could think instead, COVID will pass, humans will survive, and we will find new ways to be social again. We've been talking a lot about that, but what about pain? What about if you're in pain and you have a thought, my pain will never go away? Unless you have the superpower of being able to, predict the future with great accuracy, how do you know that your pain will never go away? Maybe, but a more helpful thought might be, my pain fluctuates. Some days it's better than others. That might be another way of thinking about it that at least is slightly more helpful. How about this one? I can't resist taking pain medication. I need it. Nothing else works. That's a negative thought. It's pretty helpless and hopeless. It might be more helpful to think that with help, I can learn new ways to respond to pain sensations. I want to find a safer way to handle my pain. Maybe I can look at some of these more natural ways. Maybe there are different things that I can do to turn down the volume a little bit, to make it a little bit more tolerable. Here's another thing that happens with anxiety, a negative thought. She's looking at me like I'm stupid, like I'm a loser, like I'm weak or flawed. I don't want to be around that person. Those are thoughts, but they're negative thoughts, and they're not particularly helpful. What's more helpful is to think that other people have thoughts. They might be bad or they might be good. I actually cannot read other people's mind, so I don't actually know what someone else is thinking. I just think I know what other people are thinking. But other people's thoughts are also not facts. They're just thoughts or ideas or opinions. And just because someone has a thought doesn't mean we have to act on them. So I want to tell you about how avoidance becomes a habit. And I'm going to see if I can share my screen. We'll see how this works, because earlier today when I tried it, it froze up. So let's try. All right, here we go. So how does avoidance become a habit? I'm still not happy with this. Let's see if that works. Can everybody see that? I hope so. So
no, we can't see it.
You cannot see that.
Paul, you want to turn off the spotlight?
Try one more time. Ah, here we go. How's that? Can you see that now?
Yes, we can see it now.
Great. So how does avoidance become a habit? All right, this is just a little simple graph. I want you to think about not necessarily the lines of the words on here, but just what's happening here. When we are exposed to a scary situation, we are going to have a reaction in our body. In this case, it's adrenaline going up. Now, you may find that when you watch television, if you watch the news or you're on social media, if you pay close attention to your body, we don't have all this fancy equipment in our homes, but if you were hooked up to all kinds of electrodes, we would see some change in your body when you see something scary going on. If you're on the media, you could do it if you saw a tiger in the woods too. But our bodies are going to react when they are faced with something scary, and we're going to go up with the adrenaline, and eventually it's going to come down. And so that's the first thing. The second thing is, and this is not the prettiest slide. Let's go back. This right here is a curve that goes up and then back down. This is the first time a person gets stressed out. The first time someone gets stressed out, up goes the adrenaline. And in the average person, it takes 10 to 30 minutes for that adrenaline to dissipate until it's back to the normal level. But most of us don't have just one thing going on. Just as we go up and things begin to level off, let's say back before COVID, you were trying to get your kids in the car to take them to school. Everybody is rushing around and arguing and maybe losing things, and there's all this chaos, and finally you get into the car, and as you finally got everybody into the car, and now the car won't start, so you get a new surge of distress coming up. And while you're trying to get the car to stop, the kids start fighting in the back seat. And then it starts raining. And then something else happens. I mean, this is much more like what people's daily lives are. We don't have just one stressor. We typically get a chain reaction of them. And so if about here is where average levels of adrenaline live, as we absorb these multiple levels of adrenaline and these events that keep stressing us out, we get used to living closer to up here. This feels like normal. And if a person has an anxiety problem, they mostly live up here. And the problem with that is over time, this level of chronic stress leads to physical problems. It wears us down physically, and that's where we get chronic heart disease and other just wear and tear on our body. So if a person has anxiety and is stressed out with blood pressure, it's a good idea to get to do something about it. But right here is what happens with the other thing that happens. And this happens whether it's with an addiction or with any other kind of a thing that we're doing, panic or whatever. When a person gets anxiety and they start ramping up with the anxiety, and it goes up and up and up, about right here, people say, enough. I can't stand this. I can't do this. I don't want to do this. It's too hard. It's too scary. It's too awful. And they will do almost anything to avoid it or escape from it. And as soon as they do, the anxiety drops. And it's wonderful. Let me do that again. That is so rewarding. I feel so much better. The problem is, this is habituate, but there's no new learning. Nothing new the person has not learned anything new. And so when they are faced with an anxiety-provoking situation again, the anxiety comes back and we go around again. And we do it over and over and over like that, around and around and around. Then we get into, we're just stuck. That's an automatic process. Now I'm going to try to get you back and see if I can get off of screen share. Am I still on screen share? Or do you see me again?
You're not still on screen share, but we are close to 250. So we do need to move on to more.
Hurried up. Okay, I can do that. So that's how we get into the habit of using avoidance when we have fear. That's just the main thing you want to know. And when we get into the habit of avoidance versus fear, we don't judge well. We're just busy onto avoidance. Look, our risk perception becomes really distorted during those times. So I wanted you to know how we get fear started, because if you have a lifestyle where you're avoiding change, whatever that is, if you are overloaded with stress and you're just living with it and just bearing it's not healthy. And so I want you to know there's help. There's ways to get past this. There's some self-help strategies you can use. You can work with a therapist, but there is help. And somewhere in here, I bet my contact information is available. Please feel free to reach out, and I'll point you in the right direction. I don't want to take up more time, so I'll just end.
Thank you so much, Dr. Celeste. We're going to move on to Dr. Tanya Martin. Dr. Tanya Martin is a licensed psychologist at Fort Bend County Behavioral Health Services, where she conducts forensic evaluations for the county criminal and juvenile courts, including competency to stand trial, sanity, violence risk assessment, fitness to proceed, lack of responsibility, and juvenile waiver evaluations. She earned her doctorate of psychology degree in clinical forensic psychology from the Chicago School of Professional Psychology, Chicago campus, and her bachelor's of science and art degrees in psychology and criminology at the University of Florida. Dr. Martin also currently does contract work with the Adolescent Center and Mental Health Services, a private practice in Houston, where she conducts psychological evaluations and therapy with children, adolescents, and adults, most of whom are involved in DFPS. Dr. Martin is dedicated to increasing her professional competence through research and continuing education, and to providing quality care for her clients. Please welcome Dr. Martin.
Hello, thank you so much for having me today. Today I am going to speak a little bit, of course, very closely related to what the other speakers have talked about. I'm going to be talking about the mental health conditions that we're seeing an increase in due to COVID-19. I do have a PowerPoint that I will share, so let me go ahead and share my screen. Okay, so hopefully everyone can see that. So today I'm going to be talking primarily about the increasing anxiety that we're seeing as a result of COVID-19. So Dr. Schell and Dr. Conlon talked a lot about anxiety that we're seeing and how exactly to cope with that anxiety. So why are we seeing such an increase exactly? And so in addition to possibly contracting the virus yourself or knowing someone, if you have a family member who might be at a higher risk than you, there's no end date to this particular pandemic. We don't know when exactly it will end. We don't know how long it will last. And so that can lead to a lot of people feeling like they have a lack of control where the pandemic is concerned. Also, our schedules are disrupted. I think probably for most of us, this might be the first time that we're seeing entire school districts go virtual. And that can disrupt not only the child's daily kind of activity and daily schedule, but also their parents who have to make sure that they're on the Zoom when they're supposed to be, and make sure that they're actually paying attention to it when they're supposed to be. And so our schedules, no matter what your schedule looked like beforehand, has been disrupted quite a bit. We're also teleworking a lot, and we're experiencing Zoom fatigue, which is a very, very real thing. When Dr. Shell was talking about how important it is that we get up and move around, now some of us are glued to our computer even more than we were before. And so it's very, very important to still still be active and get outside and to kind of get away from your computer screen so much. A lot of people are also experiencing financial instability. And so, of course, we've heard of the many, many people who have either lost jobs or they've gone or have been placed on furlough. And so that financial stability that they once had has now been shaken. And of course, we also are seeing the grieving in various ways, which I'm going to talk about in a little bit, just how COVID-19 has led to a different conceptualization of grief. So when we talk about anxiety and depression, in particular children and adolescents, and so the other speakers did talk quite a bit, of course, about anxiety and about depression. So of course, we know that anxiety is the fear, worry, or dread that can impair one's ability to function, and it's really disproportionate to the person's circumstances. So when we talk about children in particular, some signs of anxiety in preschool age can be some regression in development. So perhaps some bedwetting. For middle childhood, we see some complaints of stomach aches, maybe avoiding activities that they once enjoyed. And then for adolescents, we can see more irritability, more lack of focus, distractibility, and hypervigilance. Now, of course, we know that some adolescents in general can just be, a lot of adolescents in general can be kind of irritable, kind of lack focus. But really, we're looking at, there's an increase in these kind of behaviors. And then also we are seeing, we can see some depression in some children and adolescents where it relates to COVID-19. And it's important to recognize that depression as compared to or in contrast to general sadness is that depression really creeps into all aspects of a child and an adolescent's life. So it really creeps into, their sleep, their appetite, their ability to socialize, or just their propensity really to socialize with others. Depression also doesn't always have a trigger. So sometimes when you ask a child or adolescents, why do you think, or what is making you sad? Sometimes it's hard for them to really identify that, and they can't really pinpoint one thing, and that can be common. We see a lot of disrupted eating and sleeping patterns. Sometimes they'll have little or no joy. It can, of course, be hereditary, and we'll see sometimes some self-blaming, some low self-worth, self-harming, and also suicidal ideation are, of course, more severe symptoms of depression. So these are just some general signs of anxiety and depression just to kind of look for, especially as parents are now home and families are now home more together. If you're thinking that maybe COVID-19 is impacting your child in some form or fashion in a negative way, these are just some general signs and symptoms to look for. So I mentioned just briefly on another slide about grief. So COVID-19 has really been kind of described as a time of collective sorrow, which Sherry Cormier, who is a psychologist, and she specializes in grief and grief mentoring, that's what she has kind of described COVID-19, because in some form or fashion, everyone has lost something. So when we talk about the simpler type of grief, we've lost kind of the way our social connections usually look. So, if you are someone who or who is constantly kind of going either to places with your friends or with your family, out to eat, if you have date night regularly with your spouse, significant other, that has had to look very different in the last few months. There's also this loss of feeling of community, increased feelings of isolation, that loss of financial security that I spoke about too. And also, even if you don't really feel those few things, sometimes, just watching the various systems that we depend on kind of destabilize. And so, a lot of us probably before the pandemic have really seen things like our job, where we live, kind of those things are very, very stable. And now we've seen that COVID-19 has come along and really destabilized that for some people. And so even if it hasn't happened to you, you're really watching individuals and various systems destabilize. And then not knowing when or if we'll return to normal or what will be the new normal. And that definitely can kind of lead to and increase those symptoms of anxiety that I mentioned before as well. And these losses and changes can really affect our sense of predictability, our control, our sense of justice, and the belief that we can protect our children and elderly loved ones. And of course, these are among the losses that can be addressed by mental health professionals. And so these are really a lot of things, like I was saying before, that we probably have seen or have interpreted as very stable in our lives. And that really has been shaken recently. And so what we see is that COVID-19 kind of experiencing is almost kind of like we're grieving a living loss. So it's one that keeps going and going. We don't know when exactly COVID-19 will be over, so to speak. And so we're constantly kind of thinking about where are we in that process, and when is the end going to be? When is the end of that going to be near? And then we have, of course, more complex grief. So unfortunately, say losing a loved one to COVID-19. And so the grieving process can really be different. We have this added layer of where you have to have physical distance during crucial moments when closeness is really needed. And so examples would be, if your loved one unfortunately does get COVID-19, they're in the hospital, the first thing you want to do is rush to the hospital. But unfortunately, we're not able to do that. Funeral and memorial services, unfortunately look very, very different. And that's whether you've lost a person to COVID-19 or not. Just because of maintaining physical or social distancing, those processes have to look very, very different. And so that can really also add another layer of depression and sadness to a situation that is already very difficult for individuals. So what we see now is this kind of COVID-related grief. And that's, of course, like I said, the loss of the social connections, loss of all of these different things that people are feeling as we go through this pandemic. And so really the nature of a person's attachments can really have an effect on their reaction to the grief. And so, of course, we as individuals, we can have attachments not just to humans, we can have attachments to places, to projects, our possessions, our professions as well. And the pandemic has really forced us to confront the frailty of those attachments. And so it has really shaken the sense of self of a lot of people. And so, our clients or individuals in the community really can experience grief over anything that feels like a loss of identity. So what we know is that the research shows that losing a job really triggers a period of prolonged grief that is distinct from anxiety or depression. And why the research thinks that is because of the self-esteem that individuals feel when they are or feel to that particular job. So the self-esteem that they experience. So it can look different than anxiety and depression. So exactly how to cope with COVID-related grief. And so one thing that some of the grief research says is, understanding that grief is natural and that most people are resilient. And so this particular research study, really shows or really kind of gives the suggestion to really think about grief and really think about it in a really not realistic, but just kind of bringing it to terms and saying, this is not the way the world is anymore, and I need to adapt. And really understanding that it's okay to feel grief over what we're losing, and that it's natural, and that it's okay if we feel the grief over what we're losing. And I really like this particular research because it's more strength-based. It really kind of pulls on kind of talking about that your grief is natural, and really kind of assuring the person that what they're going through is okay. Keeping a journal. Dr. Shell talked about this during her talk, and this is a good technique for both adolescents and for adults. Keeping a journal is very good in terms of grief as well, because it really helps the person to put words to their losses. A lot of times when we experience some type of loss, it's very easy to get caught up in kind of a haze, kind of non-conformed blob of what we feel. And so when we kind of have this journal, we're really putting our words to the losses, then that can really help us to kind of describe how we're feeling and really help us to get through it as well. And really being detailed in what you're losing and how you can work through that. And of course, social connections are still very, very important. So some general tips for self-care. I won't go into too much detail since I know the other panelists have talked quite a bit about it. But, taking care of your basic needs, eating well, staying hydrated, sleeping, exercising, all those things that Dr. Shell gave some amazing tips about. Engaging activities to help manage stress, keeping your daily routine, and taking self-compassion breaks. So, recognizing that you might be having a difficult time and you're just going to take a break and be kind to yourself in that moment. And so those are some general tips for self-care there. 5 ways, just some simple ways to help children with anxiety specific to coronavirus as well. Jennifer Cohen Harper is an author and educator, and she really works to support children and teens through different resources like yoga and mindfulness. And so I really like this because these are some really quick, helpful tips. Manage your own nervous system, or, in terms of like self-care and things like that. Be honest with the child, but don't be an alarmist. So give the particular information, but also communicating to the child that, as number 4 says, reassure them that the grown-ups are on it. Teach kids what they can do. So helping them kind of feel a sense of control, and then also reducing anxiety with exercise and fresh air. So when we talk about, just the self-care or kind of managing that nervous system, that again goes back to that self-care for yourself. So breathing deeply, taking breaks, turning off the television, a lot of the times TV can really inundate us with information about, of course, COVID-19. And of course, it's good information to know, but sometimes it's just helpful just to kind of disconnect and step away from that. Contacting supportive friends and family, because when you take care of yourself, then you're better able to help our children and adolescents. So taking care of yourself, managing your own nervous system is very important. And then you're able to really help to calmly assure the child, helping them maybe list things that have not changed in their life. So this is one way that they can kind of feel that control, or kind of have some type of control that they've lost. Normalize the anxiety for them, and then really communicate that information to them in a calm manner. Three things that you can do also is to establish, plan, and practice. So establish a routine and really be proactive in keeping that routine. In our department in behavioral health services, we've been talking quite a bit, during staff meetings about how we're managing everything going on with COVID-19. And one thing for me is that it's really been helping me. I have to be proactive and be serious about my sleep schedule, and also my exercise and activity. I've noticed that, getting consistently 7 to 8 hours of sleep every night, as Dr. Shell said, she's absolutely right. It's something that is absolutely needed for our general wellness, especially in a time like now. So really being proactive about keeping your routine and and especially an outdoor activity schedule, getting out there into the sun, into the fresh air. Also planning a schedule of activities for the week. And of course, letting the child help you plan so that they could really be involved in that. Practicing calming techniques, so providing a comfortable place for the child, and encouraging movement and sensory activities. So one of the last things that I wanted to talk about is just how to find happiness during the pandemic. This was actually a research study that we put out, our department, Behavioral Health Services, put out for the county via Human Resources. And it's this research by Dr. Barbara Lee Fredrickson, who is the head of the Positive Emotions and Psychophysiology Lab at UNC. She did a recent study where she surveyed 600 Americans, asked about their daily activities, and that was correlated with the degree to which they experienced positive or negative emotions. And so what the results were, and the results are not going to be that shocking, I'll have to give you the heads up. But the results are that, when individuals who said that in the previous 24 hours when they did the following, they were more likely to report negative emotions. So passively scrolling on social media, interacting with people purely through chat or text. Whereas individuals who communicated more positive emotions in the last 24 hours, they were more likely to report the following type of activities. Exercise, self-care, engaging in spiritual activities, interacting with people, but via video or face-to-face interactions, and going out of their way to help other people. So again, these things are they're not groundbreaking, they're not earth-shattering, but the thing is that some people still have trouble implementing those things. And so how is it that in COVID-19 that we can kind of implement these things? Of course, with additional mental health services if needed. And one way to do that, to help us engage in the second type and not the first, might be just a simple difference in wordplay. So thinking about it as less so of a social distancing and more physical distancing and social solidarity. So, just because we have to be apart from one another doesn't mean that our social connection needs to also dwindle. So kind of taking the time to still meet with your friends and your family members at the same, time or in the week that you usually do. I have a coworker that does Zoom family meetings, I think every Sunday, because they used to see each other very consistently before the pandemic, and so they still do that. And so that's definitely one way to kind of maintain that social connection with others. These are just some helpful resources that I wanted to list on here for everyone. I think some of these are things that Dr. Shell and Dr. Conlon might have mentioned. The Calm app is an amazing app. There is a free version. I use it as well. I actually use it every night to play a sleep story as I fall asleep. And it's an amazing, and some of these other ones, Insight Timer, she also mentioned, is really good. These are just some general references and links. And that is my contact information in case anyone wants to reach out or has any questions or anything like that. So with that, I will turn it back over to the coalition.
Thank you so much, Dr. Martin. That was excellent. Thank you to all of our panelists. You guys gave us excellent information. And now let's go ahead and start the Q&A. Christina, you want to lead that?
Hello, everyone. Let me pull up really quickly because I was in one of the Q&A pods to see if there were any other questions that had come through. I wrote some down also. And I guess this could go to any of the panel speakers. What can I do to help my teen deal with social anxiety as well as the fear of COVID-19 upon returning to face-to-face school?
So that's, go ahead.
Go ahead.
No, that's a great question because, you know, once we get used to what is now the new normal, then we're going to again have to adapt to how things used to be. I really think it's important, education and knowledge is so important to really give them the right knowledge as well as the tools to be able to keep that anxiety level down. And just like the other speakers and I spoke about earlier, the tools of being able to really have that mindfulness and the deep breathing and to know that it's okay. First of all, I think it's really important that everybody knows it's okay to be anxious. It's okay to feel uncertainty. It's okay to feel that this is just so difficult because it is truly unprecedented. Once we validate those concerns and anxieties and fears, we can really then address it by giving everybody the very simple tools that I think all three of us spoke about with, you know, the right routine and the sleep and the activity and the mindfulness and hydration and eating healthy and taking time and really trying to make sure that you know what you're feeling, validate those feelings, and get the help if help is needed. Because there is some fantastic help out there, and let's give them the tools to be able to address that head on rather than just pretend it's not happening. I think pretending it's not happening is probably the worst thing we can do. So validating and giving them the education tools is my tip.
Now, I kind of lit up on the word social anxiety, so a couple of things I'd like to suggest. First of all, if a person has social anxiety, really has social anxiety disorder, they may have been hiding it or masking it because if you think about it, if a person has social anxiety, they don't want anyone else to know. And so they may fake it and try to show up in places that are really, really difficult. That's a specific disorder. But right now, almost all of us are feeling a little bit awkward about getting back into social situations. It's unusual. It seems strange. I mean, we're not used, of course we have friends and of course we like to do stuff, but some of you may have noticed that you're really pretty comfortable in your homes and not having to get dressed and go out. It's kind of cozy and nice, and why would I have that routine disrupted? So there's a part of going back out into society that's a little bit like jumping into a cold swimming pool on a hot day. You know, you can either just jump in and get the shock, but some people prefer to ease in. But regardless, it's going to be a change and it's going to feel kind of unusual in the beginning. And so give yourself a break, take it, be easy on yourself, start slow, know that it's going to feel unusual and weird, and then just go ahead and do it anyway. And if you can't, then get some help.
Thank you. Thank you so much. Also, another question. I'm working from home and feel disconnected from my routines. What can I do?
I would say, as much as possible, try to determine or figure out a virtual format of your routine. So as much as you can, really just kind of think about your routine and then try to think of exactly how can you kind of still keep the similar format and just kind of do kind of similar things. So for example, I used to go to the gym like 3 times a week. But now I can't really do that, or not the same gym. And so now what I do, I still work out, but I'll go to the park instead, or I'll work out at home instead. So my routine does not look exactly the same, but I'm still kind of doing the same activities. So kind of see what you can do in terms of mirroring your routine now, but maybe just in a different format.
I agree with that. I think that, there are some wonderful online applications that you can do. So if you used to go to a yoga class, get the app, perhaps that I suggested, called Down Dog, and do yoga at home. Just like Dr. Martin suggested, if you went to the gym, sort of create your own. Or the other really fun thing is there's a lot of Zoom Zoom type of workout classes, if you will, and group video classes on YouTube that you feel like you're a part of, a larger group of people. I think that's really amazing, and you can certainly do that and feel like you're sort of in the activity. Going to the park is great. You just have to be careful about your social distancing, but I go to the park all the time. I like to walk outside all the time. I just love nature. So I love being outside, and you still feel like you're seeing people and you're around people. I think something else that was mentioned earlier is doing calls with your close friends and your colleagues where they're not all work-related calls, right? They're just fun laughter calls. I've actually done something silly like, even doing a call with some girlfriends or my sisters where you play some music and you have a virtual dance party. Anything like that goes. Anything that makes you feel connected. Look, we're social beings. Human beings are social beings. We want to feel connected. We need to feel connected. And I find myself really staying connected to a lot more people because there's no more drive time. There's no more, even when I see my patients, I'm doing mostly televisits. So I actually feel like everything goes quicker and easier, and I just am left with more time with my family and friends. And it's just actually just count your blessings and be grateful for all the good things it's brought us. I think it's brought us closer to a lot of people and had a lot of more quality time with our family, more dinners around the table, more board games. So those kinds of things I think have really helped a lot, and hopefully that'll help you as well.
All right, thank you so much. I also have a question in regard to some apps that Dr. Martin had shared, and they did not catch all of those.
They were, could you repeat what the question was? Sorry. Oh, you're muted. There we go.
You had shared some apps, and they were saying that they did not catch all of the names of the apps that you shared.
Mm-hmm. So the Calm app is really good. That's one that I actually use. There is a free version, and there is a version that, of course, you do have to pay. There's also Insight Timer, Smiling Mind, Stop, Breathe, and Think, and UCLA Mindful. So the ones that I've used are the Calm app, and a while ago I did try out Insight Timer a little bit, but I'm most familiar with the Calm app. There's also I didn't put it on the slide, but there is a Christian meditation app, if anyone is interested. It's called Abide. And so that one actually is very similar to the Calm app, and it uses like different Bible passages and things like that as meditative type of strategies. So those were the ones that I had on my screen. Mm-hmm.
If I might mention, if you are a medical professional or if you're unemployed because of COVID, I think Headspace has a free subscription for you.
Okay.
And Headspace has lots of different, it's not just one thing. It's kind of like a level system. Once you get through the basics, it opens up new options.
Okay.
Okay, there was, it looks like one last question. It says, my kid notices that she lacks the stimulation from being in the school with the crowd, even if she has been a wallflower. This can be as simple as noticing and helping others in her path to have her changing her walking path. Do you have any tips? She has been in several virtual meetings, but they are not stimulating for her.
Mm-hmm.
I'm thinking, go ahead.
I'm thinking anytime you do something to help somebody else, it will get you a little bit out of that. It's hard for a teenager to do that, but there are, there's the shelters, they still need help with dog walking. There are food drives going on all over the place. There are people who, depending, but basically it's, you have to give to get something back. So if you don't have the energy to give to someone else, then you need to look into that. But for example, there's all those fun things of people going out on their front door and just starting playing their musical instrument or singing. Maybe call a neighbor and say, come out on your front porch and let's do this dance video with me. I mean, be silly as possible. But maybe you could tell us more about the question, what the struggle is.
It says specifically ask how to get stimulated while no gathering can take place. The focus is not on how to help others, but how to get stimulated from people interaction.
Okay.
I think what Dr. Conlon mentioned, I think, is a wonderful idea where, we all have neighbors, we all have communities, we all have access to outdoor parks and things of that nature. I think a lot of us, and this person is not alone, a lot of us want to feel a real human connection rather than a virtual human connection.
Mm-hmm.
So I think a lot of us can relate to this. But I have seen a lot of people do this where they have sort of a cul-de-sac party where everybody's distanced and, in their areas, but they're playing music and they bring their own food out or their own drinks out or what have you. And similarly, a lot of students can do that, but of course, limited to the number that we are limited to, etc. But do it in a safe way where you have a set of perhaps 3 to 4 to 5 people, their friends or what have you, that meet at a park with distance, with their masks, and do safe things, but are still around each other. As an example, my daughter just left for UT Austin, and college is a very different experience right now.
Mm-hmm.
Home life is a very different experience, but they are finding locations outdoors where they'll just grab some food and sit with the social distancing outside and be able to have some human connection. And I think something is better than nothing for all of us. because we're all adjusting and we're all adapting. And different things will work for different people. But first and foremost, I want to validate that concern and that feeling of feeling isolated, because it is true. It's happening to all of us.
It is.
Once we validate it, I think there are different things that can be done. And just going in nature, I think, would help, because you'll see other people out there. So stay safe and healthy, but definitely, you want to see other human beings. I think that's natural.
Something that I actually read up on recently was people watching at the park. Instead of bird watching, you're people watching.
People watching, yes.
Absolutely. Absolutely.
I don't have any other further questions at this time, unless there was anything else that any of you wanted to add.
I saw somebody asked about depression.
I see here in the chat box what causes depression.
So depression is often caused by unrelenting stress. It just wears you down. There are a lot of other sources for depression. If you have family members that have depression, you may be more vulnerable to it. But I was talking earlier about watching out for your negative thoughts. Depression can come because we start with that black and white thinking, all or nothing thinking. It's hopeless, it's helpless. Nothing is ever going to be the same. There's nothing I can do to help. There's nothing I can do to make it better. When there are lots of things that we can do, it's just that it's not big things. Like, we want a quick fix sometimes to feeling a whole lot better, being a whole lot energized. But really, a little bit of something goes a long way. Finding one small pleasure that you give yourself permission to do. If you don't have the energy to go out and sing with your neighbors, then do you have the energy to listen to your favorite song? Do you have the energy to sing along with it quietly, maybe in your bedroom? I don't know. Whatever little bit of thing you can do, every little bit of that is positive. And so you want to watch out for the all or nothing thinking, the helplessness and the hopelessness. And if you start feeling that way more and more often, ask for help. We didn't mention that during this time, people need to know that there are lifelines available. The National Suicide Prevention Lifeline is there. They have a phone number. They have a texting and a chat option. There's a 211 hotline for people. There's an LGBTQ, the Trevor Project Support Center. Those are all resources that people may need to look for. Also, I put on the website, or in the chat box, the adaa.org website. There's a lot of good information that is there about anxiety, but also about depression, for self-help resources. And so don't sit around depressed. Get somebody to help you if you can't help yourself a little bit, because it just isn't a good time for us to be living with that. We're going to have the natural amount of sadness and depression, but I'm talking about when it really starts getting to you.
I'd like to just add to that. I think that was a great point, Dr. Connie. I'd like to just add that there are a lot of other physiologic things that contribute to mood disorders, whether it be depression or anxiety. It could be not getting enough and the right nutrients. It could be the hormone called cortisol, which is your stress hormone. And so when you have too much or too little and your circadian rhythm is off, you can have feelings of depression, anxiety. It could be not enough hormone, the melatonin hormone, which is released, when things are dark in the room and you're trying to sleep. For adolescents, and it starts in adolescence, there could be some hormonal imbalance. There would be hormonal imbalance with even things like estrogen, progesterone, testosterone, DHEA. If there are signs and symptoms of hormonal imbalance in young adults or older adults, whether it be irregular cycles or it be menorrhagia or pain or infertility issues or other issues in slightly older adults I'm speaking about. And then if you're a male, if you're having issues of just not having enough stamina, the muscle mass isn't happening, the motivation, the memory, these are all signs that there are some underlying root causes in addition to the stress that we've spoken about, Dr. Conlon and Dr. Martin have spoken about. There are really other things that you have to look at as well, especially when you talk about nutrition. And if you're not eating the right foods, and if you continually put inflammatory foods in your body, such as dairy, gluten, sugars being the highest and the most toxic, of course, as we know. If you continually put colas and chemicals and diet drinks or regular sodas in your body and not have enough hydration, that really does cause an imbalance in your nutrition, increases the toxic levels in your body. It really causes havoc on the gut. And there is a huge gut-brain connection that we know in integrative medicine now. We see patients for that all the time, where if you're having GI disturbances like constipation, diarrhea, bloating, gassiness, indigestion, you know that those hormones are the brain neurotransmitters have receptor sites even in the gut lining. So that is also going to lead to some forms of depression feelings, anxiety, etc. So we actually check all of our patients when they come in reporting depression or anxiety. We actually look at their cortisol levels, we look at their hormone levels, their thyroid levels, which is a very underdiagnosed condition because we're not looking for optimization of thyroid, we're just looking for a number on the TSH, which is not even where it should be. We're looking at a very wide range. And thyroid, low thyroid, and subclinical hypothyroidism can truly cause a lot of depression, insomnia, a lot of physiological symptoms like weight gain, fatigue, and those can then lead to depression as well. So I'd really like to add, alongside the stress and the components of everything we're dealing with COVID, you must also consider looking at the physiological aspects of what functional medicine was built on. And that's all diseases start in the gut, and there are neurotransmitters in the gut and other parts of our body. So look at your nutrition, maybe get yourself tested for food sensitivities, candida overgrowth, cortisol, and other hormones. And I think you'll discover things that can be easily actually addressed.
Also, you're right, Dr. Schell. That is, I'm so glad you brought that up. The research support for anxiety and gut issues is getting more and more exciting as we're finding a clearer connection there. And it is so important to be healthy in your body in order to be healthy in your mind. Someone mentioned having trouble getting into a schedule and keeping to their regular routines. And I want to mention that lack of sleep is probably one of the first things I look for when someone tells me that they're depressed. If you are not leaving your house and you're staying inside all the time, you're not getting any sunshine, you're not moving your body, and then you're not resetting your sleep cycle. And so working on sleep sometimes really helps. The other thing is, if you're having trouble keeping to your routines, I want to suggest that you pick one thing, not everything. Pick one thing that you're going, I'm not doing this, like you're not going to sleep on time, or you're not having meals at regular times. Don't try to solve it all. Just pick one thing and work on that one thing for about 3 weeks. And do that behavior change on just one thing. That will give you energy to make another change later. It doesn't have to all happen the same day.
And I like how you said 3 weeks, because it's a well-known fact that it takes 21 days to create a new habit. So absolutely, take small bite-sized pieces. Don't try to change everything all at once. I'm giving you a great deal of information, but pick and choose what works for you. But start the journey. Start it today. whether it be just deep breathing today, taking a walk, whatever appeals to you, focus on just taking care of yourself. And that will be just the intention of you wanting to do that is half the battle. So good luck.
All right, I would like to thank you all and thank our panel speakers for this amazing information. We are sorry, we're a few minutes over the time, but the discussion was so lively and so great, so we wanted to make sure we continue. If you would like to have a certificate of attendance for this event, please email me at ppatani@fortbendcouncil.org. The email is in your chat box. Also, the recording of this event will be available on our website, fortbendcpc.org, next week, so please look out for that. Once again, thank you so much, and thank you our panel speakers for this amazing information.